lot of times, if you're trying to get them through and maybe they're pretty weak, so for me going from this wheelchair with this huge arm right here, it's going to be harder, and I might actually tear my skin or cause a big bruise or really hurt myself, because when I'm moving from this surface to this one, I'm hitting this. So it's really important to try and move those arm rests out of the way if they're just going maybe from their wheelchair to their bed. Also, leg rests, if they're in the way, if you think about it, in the wheelchair, they're sitting here. If they're only like pulled out to right here, those things like to swing back and forth. So they could cause a tripping hazard for you or for the patient. So it's really important just to take them off and then not just set them on the floor, set them up somewhere where you're not going to trip, or they're not going to trip on it also. We always want to make sure that we lock the brakes on all equipment. So if you're using the Hoyer and someone's in a wheelchair and then you want to bring them to their bed, you should always lock the surface that they're in and the one that they're going to. So lock the wheelchair and then lock the bed. Same with if you're using a walker, if they're standing at those four-wheeled walkers, those things like to roll. So making sure that you push down those brakes on either side so that when they're stand, they're having good balance and they're not going to fall. You also want to really make sure that their medical equipment is accounted for. So if you know someone uses oxygen, then you want to make sure, even before you transfer them, that their portable tank is full and that they have their nasal cannula to actually use it, and that it's on the surface that you're taking them to. So if someone uses a wheelchair, you could put the portable oxygen that's full in the back, maybe wrap the cord around the handle out of the way where you would be potentially touching it during the transfer, so it's not touching the ground. Because if you think about it, they're putting it in their nose, it's in their airway, you don't want any kind of infection for them. And then also, if they have maybe a catheter, then you want to make sure that the bag is always flowing downstream, but it's not touching the floor. So same concept, you can either attach the bag to you while you're transferring them, or attach them to like the chair on the side, or find like a little area so that they're not dragging. It's also not drilling. Okay? Make sure that they have non-slip footwear. So this is a big one, because a lot of times they'll come in and someone has just gotten up for bed and they're really cold. I run into this a lot. And so they have the socks on and they're like, there's no way I'm getting my socks off right now. But they might not have the little grips on the bottom. So either encourage to put on a shoe that maybe has a back and a hard sole instead of just like slip-on slippers. Most of the residents have the really good footwear. Or just put on their shoes, and then when you change them later, then just take the shoes off again. I know it might seem like extra work, but then you know that they're safe. Not just getting up, but if they're going to walk into the bathroom, they already have non-slip shoe wear on so that they're less likely to fall. And then also, like Maggie mentioned, getting a gait belt, and then also either a walker, a Hoyer, or any extra help you need. And you should always, always, always have 2 people when using the Hoyer, but we'll go into more of that in just a little bit. So that's our second thing. So we're considering the resident, we're setting up the transfer, and then now we're going to help position the resident. So when you're sitting, a lot of times we try to get our residents all the way back, right, so that they're comfortable and they're having good body mechanics, they're good positioning. But this makes it really hard to stand up, especially if you're weak, to get up from back here. So what we want them to do is to have them scoot forward so that they're closer to the edge of the chair. You're going to bring your feet back just a little underneath your knees so that your base of support, which is all the areas that are touching a surface, so my feet right now and then a little bit of my thighs, you want your base of support to be kind of behind you so that your weight, when you shift it over, will be over so you're not limited. Because if I'm trying to stand, again, like this, it's hard for me to do. But if I have my base of support behind me, it's a lot easier for me to stand up. And then have them lean forward. You can say nose over toes, and that kind of gives them a visual. So they'll lean forward, so it's easier to stand. Okay. Also, we'll go into a little more of the positioning, but when they're standing, I always try to encourage them to push from whatever surface they're at and push themselves up. If someone's really nervous about it, then they can have one hand on the surface they're leaving and one on like a walker, or if they're out in the bathroom, putting one on the grab bar. Because if they're pushing up from here, they have more control of their movement. Also, it works to strengthen them. So in the long run, eventually, you won't have to give them as much support. But if they're reaching, again, those walkers are not great. Like, they're perfect for someone's walking around or using it just to help them, but trying to put all your weight on one of those walkers is just gonna tip back on you. So if you're having them put both their hands here, then they can get themselves up easier, and they're not tempted to be pulling on you. Because you really need to protect yourselves also, because without your help, then we're not able to help these patients either. So you don't want everyone them grabbing onto the back of your neck or on your back or pulling at your arms, because you need to take care of yourselves as well. Okay, so during the transfer, just a couple quick points is you want to explain to the resident how it's going to go. So kind of going back to the beginning where you're going to just give them short phrases. So maybe when you walk in, say, hi so-and-so, I'm going to help you get ready. Let them know this is why I'm here, this is the purpose. And then once you get everything set up, then you can start talking them through. We're going to go into the bathroom, give them time to process, and then say, okay, time to transfer, and then go through your cues. Okay, another big thing is a lot of our patients have visual impairments, and so it's really important to make sure that you're turning on the lights. And what I'll usually do, because especially in the morning, some people are real groggy and not ready to wake up, I will start with the bathroom light, and then the lights in the hall-ish, and then their main light as they start to become more alert. But turning on the light gives them more of an ability to see where they're going and what they're doing. Also, sometimes if you're tapping a surface, then it kind of directs their attention to where it is, so they have an easier time to see. And if you're worried about someone and you notice, hey, this person is having a really hard time seeing, I feel like you're struggling where to grab, it's not, you can come to us and we can just put, sometimes it's as simple as putting a piece of tape on a grab bar or their walker, just so they have that contrast, so they can see the difference between the wall and a white grab bar. Also, just like you don't want your patient ever pulling down on you, you have to be really cautious about how you're pulling them. So when you're helping a patient get up, it's always best to kind of go for the hips and the trunk, and then if necessary, under the arms, but the best thing that you can use is a gait belt. And so we'll go over that. Just because it gives you something to actually hold on to versus the person. And so then if you're protecting yourself, you're protecting them, you're protecting their skin, and you have more control. So we'll definitely talk through that. And then the biggest piece about just the basics of transfers is protecting yourself. Like I said, without you all, we can't do our jobs because you're the ones that are here constantly helping them. So it's so important that you're keeping yourself safe and you don't want to get injured either. So just those simple reminders. Who am I going to go in to see? What do they need? Do they have a walker? Do they have a wheelchair? Do I need to use the lift? Just so you can prepare what you need. And then also you need to use good body mechanics as well. So some of the key points here at the bottom is when you are removing leg rests or arm rests, to come in kneel, so you can either do one-legged, or if maybe you have knee problems, even asking maybe someone else to come and help you, and you can switch off so you're not causing yourself more pain. Or you can even come down to both knees to help take things off. That way you're not tempted to round your back. Because if you come down like this, I'm more tempted to round my back than if I'm down on one knee. Also, when you're transferring, you really want to stay close to the resident, because the closer you are to something, the more control you have. So if I'm trying to move a chair, it's way over here, I'm putting myself at risk because I'm hurting my back and trying to pull it. But if I come up to the chair so closer, it's easy for me to control. You also always want to bend at your knees and keep your back straight. So think about if you're coming out of a heavy box, right? You want to bend, pick it up. Also, when you're helping someone, you never want to twist with them, because then you're damaging. Your low back is really fragile and you could cause injury. And even if it's not that time, the more and more you do that, then eventually you're going to really, really hurt yourself. So even if it's not that one time, just being cautious so you don't cause yourself an injury. So if I'm helping transfer someone, we're going from here to here, then I'm gonna take steps to move them versus just twisting. So moving your feet. And then also maintaining that base of support. So when you're helping someone, stagger your feet just a little bit, so you can bend and have a little more control. Okay, gait belts. Okay, so the purpose of gait belts is so that you can control the patient while you're moving them. And that way, like I said, you're not having to pull on their arms or their clothes. And this also helps you because a lot of times when I put this on someone, their fear kind of goes down because I explain, hey, this is a gait belt or this is a safety belt, and I'm going to use this so I don't have to tug on you or pull on your clothes. So that's a good tool to help. So there's two different kinds. So this one is most commonly seen around here, but they may be getting this other buckle kind, so I wanted to show both. So this one with the metal mouth, how I like to learn how to use it was first you want to chew, so you're going to put it through the teeth, and then you're going to swallow, so you put it through the throat. So how it goes, you kind of want to go low on someone's hips, right above their hip bones. Come through, you're going to go up underneath the teeth to chew, pull it tight. You want it so that you can at least get 2 fingers under it. But when someone's sitting down and you're putting this on, once they stand, it's going to become looser just because of gravity. So don't be afraid to put it a little tight. Obviously, if they're really, really uncomfortable, then maybe did it too tight, but just kind of use your judgment there.